Thank you so much for joining us here today at Atrium Health. I'm Carly Stevenson, a member of our communications team, and I have here with me a panel of experts specific to cardiology to talk with you about key tips for American Heart Month. I'll go ahead and let everyone introduce themselves.
Hi Carly, my name is Dermot Phelan. I'm Director of Sports Cardiology here at Sanger Heart and Vascular Institute.
I'm Rachel Bozen. I'm a pediatrician at Charlotte Pediatrics.
I'm Noreen Kelly, one of the cardiologists with Sanger Heart and Vascular Institute.
So with Heart Month, let's start with you, Dr. Kelly. When someone is experiencing signs and symptoms of a heart attack, what should they do, and what are some of those signs and symptoms to look out for?
Absolutely. So one of the most common signs and symptoms is chest pain. That may be something like a heaviness in the chest, or sometimes people describe a feeling of like an elephant is sitting on their chest. Sometimes this may even go up to their jaw, so they have jaw discomfort, or even radiate down their arms. Some of the symptoms, however, that people may be less familiar with is trouble breathing. So feeling like you have a hard time catching your breath, or you're having a hard time completing the activity that you're doing. You also want to look out if you're having nausea, vomiting, sweating, and abdominal discomfort in the absence of other GI symptoms, because that can be a sign of a heart attack. If you think you're having a heart attack, we want you to call 911 right away. 911 will be able to do an EKG or an electrocardiogram, which can confirm whether or not you're having a heart attack. One of the things we're really proud of at Atrium Health is our door to balloon time. And what that is the time from when you show up with your heart attack till the time we have the blockage opened up. And our time is about half the national average. And we know that time is heart muscle. So the sooner that the heart attack is addressed, the blockage is opened up, the more likely the heart muscle is to be able to function normally like it had been before the heart attack.
That's really incredible, and you all, across the three of you, do cover a range of ages from kids to adults. So Dr. Bozen, as a pediatrician, what are you telling parents, and how are you working with patients to help them instill those heart-healthy tips early?
Well, I think we're really lucky in that we get to see patients since from the time they're babies all the way up until the teenage years for well checks. And that's one thing that's really important, is that kids do come in routinely for their well checkups. But the things that we tend to talk about the most are making sure that you're making a habit out of doing good things for your heart. So exercise is really important. Diet and what you're eating is really important. So we want to make sure that families are incorporating this into their everyday life. And because the more that you can do something every day, it becomes a pattern that you can keep up with. And then, really rethinking the way that we look at how we're eating, and remembering that the foods that we put into our body are really important for our heart as well. And so making sure we're changing the way that we're looking at snacks, not just picking up things that are easy, like fast food, chips, cookies, crackers, kind of trying to make foods that are healthier for you easy as well, cutting up fruit, veggies, keeping those in the fridge, cheese sticks, things that are more healthy, whole foods as opposed to just quick snacks.
So with that, what are some of the maybe key red flag issues that you may see with someone who comes in and may have a heart issue as a kid?
So I think with kids, it's a little harder because it's more difficult for them to tell us exactly what's going on. But if you ever have a child that's complaining of chest pain or shortness of breath with exercise, that would definitely be a reason to come see your pediatrician. If they're complaining of, a funny heartbeat, heart skipping a beat, if they've passed out, things like that would be reasons we would want to see kids. We certainly see a lot of kids for chest pain as well. Luckily, most chest pain in kids is related more to the muscles and the bones in the chest. But if a kid is having chest pain, we definitely want to make sure that we check them out and that their exam is normal.
So that does translate over to athletes of all ages. And Dr. Phelan, you're our new director of sports cardiology, and you're involved in screening and looking at our athletes across the region. Can you share some key tips really for them?
Yeah, I think that leads on beautifully from what Dr. Bozen was saying there. I think the important thing is that we sometimes view athletes as being immune from any heart disease, right? And particularly young people, we tend to dismiss their concerns and symptoms, and most of the time that's fine. Most of the time it isn't a cardiac issue, but occasionally it is. And so we need to pay attention to our kids and friends when they're complaining of these type of symptoms. In particular, symptoms that occur with exercise. So if you pass out while you're exercising, you develop pain while you're exercising, they're symptoms that really need to be looked at more. For those, unfortunately, there are times where people may be completely asymptomatic, and yet they still have underlying heart disease and are at risk. And so for those people, what we try to do is identify the heart disease through screening. And Charlotte can be very proud. Dr. David Price, who's a sports medicine doctor here many years ago, set up the Heart of a Champion Day, which has been a huge success. And this is really a free screening for high school athletes in Charlotte. And they get full evaluation, but they get very detailed cardiac evaluation. And every year they pick up potential life-threatening issues. And so I think they're the things that we can do on the front end, particularly for young people. We, again, have to remember the older people who are athletes and maybe don't even consider themselves athletes. They're just very highly active. And again, it's worth looking at those kind of risk factors that put them at risk for heart disease and any symptoms and talk to their doctor about those.
So in addition to seeking care in person or receiving a screening in person, there are other ways for patients to get in the door without even leaving their home. Dr. Kelly, could you share some of the virtual options?
Absolutely. So we have a very robust virtual visit option for patients, so that if you have the flu or you just feel like you can't get off the couch, you can actually just call into your physician's office and get some advice right then and there. We are also developing new programs. One of the programs we're currently developing is something called Perfect Care. And this is really focused on people who have just had something major like heart surgery. And at home, we're able to monitor their sleep, whether they're taking medications, their heart rate, their blood pressure, all of that remotely without them ever having to come in. And so we can start to detect signals that they may be having trouble and bring them in appropriately, kind of proactively. We have so many resources here for our cardiac patients in particular. We have clinics that transition people after the hospital so that we make sure that they're getting the care and their questions answered right away so they don't have to come back to the hospital. We have support like social workers, palliative care services, and so much help beyond just being seen in the clinic for our patients.
So being heart healthy really also means having the tools as a person in the community to save a life. You all are experts, and we have a lot of resources to offer, but what would your advice be to the community if they're looking to help, for instance, if somebody goes into a cardiac arrest?
Yeah, I think this is a really important point to try and get across, particularly on this month of February, which is Heart Health Month. People are often afraid to try and help resuscitate someone. And they see in the movies it looks very complex, and what we're trying to highlight to people that it really isn't. We've pushed towards hands-only CPR, so that if someone goes down and they're not responsive, that you would begin immediately doing chest compressions. And you don't need to do mouth-to-mouth, you don't need to do anything else, just chest compressions. And that actually has a dramatic impact in the likelihood that that individual is going to survive the cardiac arrest. So what we're really trying to do is get that message out to the community, because it's unfortunately rare that there's a doctor right beside someone that has an arrest. It's usually a family member or a member of the public, and everyone should be not feel frightened to do that and begin CPR only.
The training is also very easy for people that do want to get officially certified in CPR. It's usually just a few hours of your time.
Yeah.
And we can't emphasize enough that you can truly save someone's life, especially if you act quickly. Additionally, a lot of institutions, airports, facilities now have something called AEDs, automated external defibrillators, and they are specifically designed for people that don't know how to use them. It's usually just 3-step instructions, and again, applying that quickly to someone who's had a cardiac arrest can truly save their life.
So with that, I think it's important to note, as you all are watching, and thank you again for watching, we do have a lot of resources and organizations that we work together with. Those include, specifically for hands-only CPR, Keep the Beat, which is a partnership with Medic, as well as the American Red Cross. So you can go and sign up to receive hands-only CPR. We'll be sure to post the links after the live has ended. Is there anything else that you all would like to cover before we say goodbye?
I think just to carry on from what Dr. Kelly was saying, it's interesting. The safest place in America to have a cardiac arrest is Las Vegas. And that's because there's cameras everywhere and there's AEDs everywhere. And that just highlights the importance of early CPR and AED application. It can really help save lives.
Wonderful. Well, thank you so much for joining us for this American Heart Month panel. We'll be sure to post some resources for you in the comments section.